Hello? In this episode, we'll talk about why your shoulder hurts and what you should do about it. And I'll also show you 5 exercises that can help you get rid of shoulder pain. Let's talk about what the shoulder actually is and what it's made of. Actually, the shoulder joint is probably one of the most complex joints in our body. There are several joints here that are connected to each other by cartilage, have a capsule, and a bunch of different muscles. That is, we have muscles that attach from the thoracic region to the arm, and there are muscles that attach from the cervical region also to the arm and shoulder. There are muscles that go quite deep under the shoulder blade. A whole complex infrastructure is involved in moving the arm. This includes the shoulder blade, the collarbone, and the shoulder. That is, the head of the humerus. It's important for you to understand that this structure, this part of our body, is very complex. And if, for example, you feel any pain, discomfort, or even worse, a restriction of movement in your shoulder joint, that's a really important signal to pay attention to. Why is it so important to pay attention to restricted movement or pain in the joint? The thing is, if you develop scapulohumeral periarthrosis, in other words, actual arthrosis of the shoulder joint, the cartilage of the head of the humerus will start to deteriorate, and this will lead to surgery. When cartilage destruction begins, basically nothing except surgery can really help anymore. Don't let it get to that point. Pay attention to this problem ahead of time, and you need to get rid of it as quickly as possible. Be sure to watch this video until the end. Next, I'll show you a whole set of exercises for the shoulder to strengthen the shoulder joint. This will help relieve the pain. It only takes 5 to 7 minutes a day, but it's actually a very effective preventative measure that can help you avoid surgery in the future. So, who is actually at risk for shoulder overload? These are people who spend the whole day sitting at a computer, for example, slouching, because slouching puts extra strain on all the muscles of the back, and naturally, the shoulder joints are also affected. And also, people whose jobs involve heavy lifting, for example, where they constantly have to move things around and use large joints, including the shoulders. In addition, this problem is very often encountered by older people, especially after the age of 50, when various issues arise, such as problems with the nutrition of cartilage tissue, weakness of the bone system, or impaired muscle function, all of which can lead to arthrosis in the shoulder area. And of course, we shouldn't forget about another group, athletes. The thing is, athletes experience increased strain, and amateur athletes often do this in a non-professional way, which frequently leads to injuries of their shoulders, muscles, ligaments, and tendons. These injuries can later result in limitations and pain in the shoulders. What mistakes do people make when their shoulder starts to hurt? So let's go through them one by one. The first mistake is called, "It'll go away on its own." So your shoulder starts to hurt and you think, well, it's just a little pain. Should I go see someone or not? We're busy, there's no time, and we think it'll just go away on its own. And it seems like we're not putting any strain on it, but after a while we feel the pain again. And the most important thing is that we're losing precious time during which we could actually save, you could say, the joint. Because often when people neglect their condition and do nothing, they end up needing surgery on the joint. The second mistake is applying ointments to the area where it hurts. In reality, we're just getting temporary relief here, often dealing with a pretty serious problem that only gets worse over time. And we're simply losing, again, precious time that could have been used to solve this problem. By the way, give this video a like if you've ever tried to rub ointment on your pain at least once in your life. Third, chondroitin sulfasamine. As soon as joint problems start, everyone immediately starts taking it actively. But in reality, again, what are we actually doing? We're just psychologically reassuring ourselves that we're doing something for our joints. And believe me, we have a lot of patients who come in with serious joint problems, who have taken chondroitin and glucosamine by the ton, and it didn't help them. But unfortunately, they only come to see a doctor at stages when a lot of time has already been lost and a lot of tissue has been damaged. The fourth mistake. Many people, when their shoulder starts to hurt, think that they need to exercise it, strengthen it, and put more strain on it. But if you put stress on a joint that already has arthrosis, at some stage you're just speeding up the process. In cases where the joint has arthrosis, that is, when there's already a problem in the joint, you actually need to reduce the load on it. So you shouldn't overload it. Completely different, even opposite, rules apply here. And people often end up speeding up the damage to their joint. By the way, let's share in the comments. What was hurting for you, and how did you get rid of that pain? Maybe we'll find some effective methods together. Or maybe, on the contrary, there will be stories where people just wasted time. So what should you do if your shoulder joint starts to hurt? What should you do in general? Where do you even start? Well, the first thing, of course, is that you can go see a doctor. It could be a traumatologist, it could be a neurologist, and they will order additional tests for you. There's several types of tests here. The first is an ultrasound, meaning an ultrasound examination of the joint. With this method, the doctor will be able to look not only at the joint itself, but also at the soft tissues. They will examine the muscles, ligaments, tendons, and check for any tears or various inflammations. So in fact, when it comes to joints, this is a very good diagnostic method. In our clinic, we use exactly this method. So if you want to figure out why your shoulder hurts, follow the link I'll leave below this video and book a consultation. The second diagnostic method that you might also be prescribed is an MRI of the shoulder joint. MRI is a very good type of examination that will show the source of your pain. For example, where can shoulder pain actually start from? The thing is, here in the shoulder area, there are muscles attached that originate from the cervical region and other attachment points, or from the thoracic region. And if there is any problem here initially, for example, again, we return to the issue of biomechanics, a micro displacement in these small joints, this entire muscle will be in spasm, meaning it won't fully relax. And with any movement we make, this muscle will experience micro-stretching at these attachment points. And often, this problem acts as a kind of trigger. Then all it takes is for us to get stressed, lift something, or overexert ourselves during sports. Basically, any kind of irritant or trigger will set off a whole cascade of changes and inflammation in the shoulder area. That's why when we do a local diagnosis of this area, we always check the surrounding region as well. Are there any sources here that might be causing tension in this spot? And very often, in about 80 to 90% of cases, we find this problem, which of course we also recommend addressing. So let's move on to a set of exercises to relieve pain in the shoulder joint and shoulders. But first, let me tell you a few important rules you need to follow during the exercises. So rule number 1, all exercises should be done slowly, with proper breathing, and with a pause at the maximum point. I'll demonstrate this in a moment. And the second very important rule, if you feel any sharp pain during the exercise, you should stop doing that exercise. We don't do exercises through pain. Mild pain or tension, a stretching sensation in the muscles, those feelings are normal and allowed. So let's move on to the first exercise. Place your foot on the expander, and now we're going to do side movements using the expander. As you inhale, move slowly, pausing at eye level, and keep your head facing the same direction, right here, onto your arm. Hold this movement, this tension, for about 5 to 7 seconds. Then slowly lower it before the band goes slack. Your arms shouldn't go all the way down. And then lift it up again. Repeat this exercise about 5 to 7 times. You should feel your shoulder getting tired during this exercise. It's very important for the muscle to reach a relaxed state, meaning it should get really tired and find it hard to stay tense. So let's move on to the second exercise. Here, we're going to activate and target some very deep muscles that attach to the head of the humerus. By the way, this muscle often gets inflamed and causes pain. So what are we going to do now? We move the arm to the side, look straight ahead, and as we inhale, slowly turn the hand upward and lower the arm to 90 degrees. Repeat this exercise about 7 times. Be sure to pause at the maximum point. So here, in this position, hold your arm for about 5 seconds. Accordingly, after the tension phase, we remember that the muscle enters the relaxation phase. Yes, hold for a few seconds, then lower it. If doing this exercise 7 times is too difficult, start with fewer repetitions, and gradually, over a week or 2, you can add 1 or 2 more each time, because your muscles will get stronger and the pain will gradually go away. Now we move on to the third exercise. So regarding this exercise, I want to say the following. If a person has limitations, meaning they can't raise their arm high, it's too early to do this exercise. In other words, this exercise is for a later stage, when the range of motion in the joint has been restored. But if you can do a fuller range of motion, even if there's still some pain, you can do this exercise. So we take the expander, stretch it, and do a shoulder rotation over the head. Try to really turn, yes. Do this exercise about 7 times to each side. Try to make sure your arms stay straight at the elbows and keep the band tight the whole time. That is, there should be tension at the muscle level. If you feel a little pain during the rotation, that's acceptable. If you can't raise your arm that high, then for now, don't do this exercise. Usually, we give this exercise when you're already at the final stage of recovery, when you're finishing up restoring mobility in the shoulder area. But very often, people start working on, let's say, shoulder pain before it leads to limited mobility, meaning when the joint isn't suffering yet. And in that case, this exercise is excellent for stretching the muscles and relieving excess tension. Fourth exercise. I want to point out that this exercise is very important because in this case, we're not just strengthening the muscles, we're stretching them. In other words, we're eliminating hypertonicity or muscle spasm. Turn around so your back is facing us. Let's show how to do this exercise. So the starting position is to bring your arm behind your back. Now pay attention. If you have limited mobility in your shoulder and it's really hard to get your arm back there, just bring it back as far as you can. We start from the point where you feel pain right here in the front. That's it, the pain has appeared. So from this position, press the back of your hand against your back. Press. At the same time, you'll feel tension, maybe even pain, right here in the front part. Hold it for about 5 to 7 seconds, then let go. Now, give me your other hand. And with your other hand, just a little bit, take your other hand, because this one, for example, hurts, and from this position, lift it up a bit higher. So now it's already moving here with difficulty. Next, press the back of your hand against your back, again, with this hand. Hold it for 5 to 7 seconds, then let go. Do this about 3 times. That is, go to the maximum position. If your arm goes back pretty well, let's show how it can go back, like this. So we work from the maximum level. From here, in other words, press the back of your hand against your back. Here, you can already feel the tension, right? Or rather, the stretch. Hold for 5 to 7 seconds, then release. And try to use your other hand to help bring it even higher. So bring it up higher. Great, there you go. And press again. And now work at your maximum range. At the same time, be sure to pay attention when you do this exercise. Never allow yourself to feel sharp pain. That is, everything should be moderate, within the limits of how much the muscles in this area can and are ready to stretch. And don't forget, if your shoulder hurts a lot and there's limited movement in the joints, there will always be inflammation and excessive strain here. If you, as they say, overdo it, you can make these painful sensations even worse. So here, adjust these exercises according to your pain sensations. Don't allow pain. Let's move on to the 5th exercise. This exercise will help us increase the range of motion in the shoulder joint, including for people who can only raise their arm up to about this level. That is, beyond this point, people often feel pain, especially if they've already let the joint problem progress to this state. So stand next to a wall and place your arm up against the wall. If you can raise your arm to this level, place it at this level. If it hurts and you can't lift your arm that high, just take a small step back and lower your arm. From this position, take a breath and press your palm against the wall. Not with your body, but just with your palm. Try to push only with your arm. The pressure should come from your shoulder and hold for 10 seconds. Let's go. That's it. After that, relax and use your fingers to crawl upward. Keep crawling up. Well, come a little closer since your shoulder doesn't hurt. And from this position, press your palm against the wall again. Do this about 3 to 5 times. And relax. Good. Lower it down. So what I really want to say about these exercises is this. The thing is, when there are limitations in the shoulder, exercises really do play a very important role. And it's important to work on joint mobility regularly, because when there are already limitations, it's a chronic process and quite a serious problem. Don't underestimate it. It's best to do the exercises twice a day, but at least once. Doing them twice will bring results much faster. I think this video will be really helpful for many people, so be sure to share it with your friends. Also, on my channel, there's a video where I show in detail exercises to relieve lower back pain and strengthen the neck. I'll leave links to these videos in the description below this video. Go check them out. This channel is about what you need to do for your spine and joints to stay active and healthy for many years.